and welcome to our webinar on leading workplace health and wellbeing. My name is Dr. Mary Collins, and I'm part of the faculty at the RCSI Centre for Positive Health Sciences. I'm a chartered psychologist and a senior coach practitioner, and I am delighted to be joined today by two absolute pioneers and role models in the field of leading workplace health and wellbeing. So I'd first like to welcome Dr. Niamh Keenan. Niamh is a consultant cardiac surgeon at Mater Private Network in Cork. And Niamh is internationally experienced in the field of cardiac surgery, and she's committed to excellence in surgical education, patient safety, and human factors. And in fact, Niamh and I first crossed paths many years ago now, Niamh, in the human factors program in RCSI, where we co-delivered the leadership module on that. So great to have Niamh with us. And I'd also like to warmly welcome Laura Kinsella. Laura is a Wellbeing Senior Manager in Irish Life. And Laura is also one of our alumni from the Centre for Positive Health Sciences. Laura completed our Diploma in Positive Health. So delighted to have Laura here, and she is passionate about all things related to colleague well-being, and again very much lives the values of positive health. So it's wonderful to have both perspectives here. We've got healthcare and we've got the more corporate organizational lens when we look at workplace health and well-being. And our centre in RCSI was founded in 2019 by Professor Kieran O'Boyle, who I know is known and loved by many of us. And Kieran's vision was very much around supporting positive health and well-being in all aspects of life. And obviously healthcare was our priority. And last year we moved to the whole area of health and well-being at work. And we launched the professional diploma in leading workplace health and well-being. So that's our focus for today's webinar also. So I'm going to get right into it with Niamh. And Niamh, I'd be really interested in your thoughts on what does a healthy workplace look like?
Thanks so much, Mary. And really, it's a pleasure to be here. I suppose I gave this a bit of thought over the last few days and few weeks. And I suppose to me, I would break it into three components. So I think, first of all, for many of us, for all of us really, we want to feel that we're doing meaningful work. And so to me, that means that people who are in a work environment have a common goal, a common vision that they're working towards, and that they understand that. They understand their contribution to it. So they know how they're doing and how they go home at the end of the day and know they've done a good day of meaningful work. And that doesn't have to be in healthcare, it can be in anything. But your job, it always wants to feel meaningful. So I think that's the first thing, is if you go into an environment where people know what they're doing, how they're achieving that goal, and that it means something to them. I think the second part to that then is, as they're doing that, the people want to feel valued. I think that's the most important thing. They want to feel supported and encouraged in their work and in their goals to sort of develop potentially professionally. And I think they want to feel accepted for who they are as well. I think people want to be able to come to work, be who they are, show their own selves, their own interests, their own personality, and to be accepted for that, and for that to be celebrated in terms of diverse workplaces are the best, because you get so much from different people. And I think you can be very respectful around that. You can ask about differences, you can talk about them, you can understand how are you all going to work together. So I think that to me is sort of, when I think about a healthy workplace, I think about valuing people, supporting people, and, you know, accepting people for who they are and allowing people to be themselves. And then for me, the third part of that is the environment that's there. So I think you want an environment where work-life balance is the norm, where it's just expected that potentially if people can go home early, they should do so. Where if someone has something related to their family or their own self, they want to go to a Pilates class like I did yesterday afternoon or whatever it is, that is seen as the norm in their workplace week. And I think that's hugely important. And I think that then tends to look like when I come into work in the morning, what I want is a place where I recognize people. I say hello to everybody. I try and chat and connect to everyone as I'm coming in. So a friendly, respectful place. So I think to me, that's what a healthy workplace would look like.
That's great, Niamh. And I think there are three really insightful points. And the meaning and purpose piece is so important.
Mm.
Feeling valued and respected, and included, that whole inclusion piece. Particularly in healthcare, we have such a diverse workforce. It's so important that everybody feels valued. So, Laura, the same question to you. What does a healthy workplace look like?
Yeah, and I would echo so much of what Niamh has mentioned, particularly that piece around belonging. So often when we think what are the things that are important to people at work, belonging mightn't be top of list. We might think of compensation or other elements, but actually completely in alignment with Niamh, that sense of goal attainment actually is huge, and cultivating an environment of belonging. But maybe to build a little bit as well. There was a piece that I had seen from Josh Burson and company on sort of the healthy organization and levels of maturity. So I guess the other thing that we can think of when we're looking at what does good look like, good might also look like progress through either one particular level of maturity, and they have four, or good might look like progress through that. So if level four is sort of the lowest level of maturity when it comes to the healthy organization, probably the things that are being focused on are more of a health and safety lens, and maybe little to no involvement with leadership. And as we look then through sort of the other levels, level two involves leadership a little bit more. The programs are slightly more built out. It's looking at a well-being experience for colleagues, and maybe starting to touch on things like financial, social, mental well-being. The third level is healthy work, where actually some of the work, to echo some of what Niamh said, some of the work is looked at, recognition of people's performance, and a focus on equity and accessibility. And then level four being sort of that top level where organizations go beyond, and there's that really big active leadership support, and well-being is completely embedded through the culture of the organization. So that's the gold standard, but good in somebody's organization or industry might be progression through that. It takes a long time to bake in all of that strategic focus. So good might look like even knowing where you are and having an eye on how to improve.
Yeah, that's great, Laura. And it's really interesting to look at it through those different levels. And you mentioned there the importance of leadership to really embed and have a sustainable, positive workplace culture. Um, and leadership is at the heart of our professional diploma, because I think so often we consider health and well-being at work, it's initiatives. Um, and we talk about, it's not about the three F's, the fruit bowls, the flu jabs, and the fitness at lunchtime. While they're all great and, very well intentioned, but it is about that culture that is created, um, and really the importance of leadership. And I'm curious about your experience, both of you. And I might start with you on this, Laura. Looking back, you've obviously worked in different organizations, different workplaces. And we won't mention any names here, but is there any best practice that you've experienced in your career?
Yeah, and I guess it's consistent with what you've mentioned there, Mary. And leadership absolutely sets the tone for culture more broadly and for workplace well-being. And we see in sort of the research report, so Gallup released a piece which sort of indicated even more, and we know it intuitively, but that leader behaviours are positively contagious. So it's one thing to sort of set the tone, but I think it's also crucial that leaders walk the talk, that it's not just the tone, that it's also the behaviours, and that those are embedded, and that there is a consistency and a congruence between what is said and what's done around here. The work-life balance piece that Niamh mentioned. And I guess in thinking about that, there's also maybe a slight watch out, because leaders are setting the tone for lots of things across the organization, and it can't all be the sole responsibility of leaders. So the other major lever, I guess, that leaders have is to empower down then through the organization. So setting the tone and creating the environment where it is supported, and it's okay that, you know, you're going and taking your time to recalibrate and balance. But that others in the organization are empowered to champion and to ambassador and to activate some of those well-being pieces. And organizations do it through sort of employee resource groups or wellbeing ambassador groups or champion groups, who then also get to develop, and thinking back to our earlier question, have that real additional meaning. Their role might be very different, their day-to-day role, but to be able to get involved then in something that has a greater meaning too, where they can contribute to colleague well-being, can also then be a wellbeing initiative, a strategic one in and of itself. So I guess my main experience is through my own organization, and I appreciate that we are a totally unique entity. So I'll also maybe try and reflect on some others that I would have seen working as a wellbeing consultant. But yeah, at Irish Life, like, our organizational strategy and vision is to help people build better futures and to be a driving force for Ireland's physical, financial, and mental well-being. So appreciate that is totally unique, and others in similar sort of areas trying to drive culture and colleague well-being, it mightn't align so neatly to their organizational mission. But I guess some of the things that, in having that as our statement, it's really important then. So we're out in the market and trying to support that for Ireland Inc. through the products and services that we offer, but also through our strategy with society and our CSR initiatives. But internally then, you know, it's really up to us then to make sure that that is led for our own colleagues, and that is their experience. So it's baked into our people strategy, where we have sort of well-being by design, and that looks at everything from how we approach our diversity, inclusion and belonging initiatives, our people policies, our recognition program, and making sure that there is a way to sort of celebrate good work, our leadership principles, which we defined and launched this year, and we've seen great engagement around that, and I guess campus development. So really trying to make sure that it is baked in at every layer. And then in thinking about some other examples, so in my time as a wellbeing consultant, there was one client who I worked really closely with. They were the first client who I worked really closely with, and this was sort of mid-pandemic. The leadership that I saw on that program, and it was a really fun initiative, but it was more than an initiative. It sort of was an 8-week program where everybody was, you know, in lockdown and working at home. They wanted to create something fun, engaging, and bring sort of mindfulness in to help reduce stress. And so they sent out, I think, 300 ukuleles, and colleagues came together once or twice a week to connect, to learn the sort of the mindfulness and the music and the learning piece, and the leadership launch and the backing for that, and their interest in making sure that we actually sort of did a scientific validation on it. So we took a pre, mid, and post survey points on it. we scientifically validated that people's well-being improved. The participation over the program was phenomenal. And then they also went out and sort of celebrated that as a moment in colleague culture, colleague connection, and colleague well-being. So that was one that really stood out for me, and the sort of the commitment to seeing through that survey and making sure that it was rooted in evidence. And one other client who I had only started to work with, and then I moved roles, but there was one sort of statement that really stood out with me and I've carried through, and it was their approach to how they were bringing topics through at their leadership meetings, and it was visible felt leadership. And for me, that is so pertinent and relevant to colleague wellbeing, and to anything actually that we want colleagues to see and to feel, and for the culture. This is the way we do things around here, that visible felt leadership. So that was applied to wellbeing, but it was applied to sort of their leadership ethos overall.
Fantastic. They're two really interesting examples, Laura. And I mean, the playing music together, I mean, the neuroscience research is really solid behind that as well. So wonderful. And as you say, you are, and you position that with the fact that you are fortunate to work in an organization that has health and well-being as part of its mission, and built into every aspect of it. And I guess, Niamh, from your perspective, from healthcare, obviously, health and well-being is a key priority. What you have trained in Australia, you've trained in the UK, you've been educated all over the world as well. Can you share with us some examples of best practice that you've seen, Niamh?
Yeah, it's interesting, as you were starting that sentence and saying that obviously I work in healthcare, and you would think then that healthcare and well-being among medical professions should be fantastic, but actually I think it's really the opposite. I think often in healthcare we're very good at looking after other people, and we're not actually as good at looking after ourselves, And I think that's a shame. And I think that's where this focus on health and well-being in work, I think it really does need to move more definitely into the healthcare environment, because as I said, we look after patients, but we don't always look after ourselves, if we're honest about it. And so I really loved what you said, Laura, there about visible felt leadership. I thought that was a phrase. I've just written it down to remember it. It's a wonderful phrase.
Yeah.
And I suppose, to me, when I think about best practice, there's certain examples that I would bring in. But when I think about the leadership, what's important, and it's probably very similar to what you said, if I was to think of 3 words that I would use when I think of leadership and what I do each day, I think it's to listen, to communicate, and to connect. And to me, I think listening to people is so important. So, and that can be just listening to what do they do at the weekend and hearing about what's going on in their lives, to obviously then issues that might be arising in work, or things that they want to celebrate, or things that they're worried about. The communication piece, I think, comes around people sharing your vision and people understanding where is their role in that vision for the workplace. And also just then that connection piece. And I think that can be connecting over work, or it can be connecting over running, or it can be connecting over music, as you've pointed out there, Laura. I thought that was beautiful. So to me, those are things that I would see as very important, and sort of seeing some examples of that. So certainly I moved from Ireland to Australia, and one of the first, I may have said this one to you already, Mary, but the first examples where I really felt a big difference in terms of how work-life balance was so promoted and so emphasized in Australia. I remember going for a team lunch with consultants, registrars and SHOs after a clinic. And the new consultant that I was working with sat down, and, it's general chat. And then he said to me, Niamh, you've just joined us. Tell us about yourself, So I, in my Irish mentality, started talking about my CV and what training I'd done and what research. And he was like, yeah, we know all that. That's great. That's great. He said, but what are you interested in? What do you like doing? What can we help you with? How can we help you settle into Melbourne? And it was nearly that question of what are your hobbies? And I was like, oh gosh. So I went into a few things, and I said, that I enjoyed museums and I enjoyed art and different things. And he said, oh great, we must think of a few things then. And that Sunday, I got a text from him. And I thought, oh gosh, this is unusual. And his first sentence was to apologize for texting on a Sunday. And then he said, but I just thought there is a Fred Williams exhibition on in the National Gallery of Victoria. It's leaving early next week. So it just might be a good one for you to see. He's a very well-known Australian artist. And I thought that was just the nicest thing, because he'd really heard what I'd said I was interested in. He thought of me for this exhibition. And it was just that real connection. And there were many examples of that when I was there. And it was a small thing, but that has really stayed with me. And I do try to sort of like, can I connect with people in work? Do I have things that I share with them? And I know we've often talked, Mary, about different styles of leadership, but that I think comes back to that authentic leadership. Yeah. And like genuinely just, because as a leader, you also want to be yourself in work. I also want to go and be accepted for who I am and, you know, feel that connection with my colleagues. So to me, I will try and always listen to people, communicate, but also try to connect. And like I said, it's not that you have to go in and share your life story with everybody, but it's about just genuinely a little connection with people that you can make. So that was one. And then I suppose similar to your ukulele story, I remember the first time when I moved to Adelaide, which is a few years later, and the secretary, when I started, the first thing she said to me was, now you need to make sure you're not on call this weekend, 3 weeks time, because we're doing lawn bowls that day. And so the team in Adelaide, which was one of the most fantastic environments I've ever worked in, they were taking an afternoon off. So they were halving the theatre list for that day. And only one of the team were staying in the hospital to look after the patients. And the rest of us were going down to the local lawn bowls club. And we had teaching in lawn bowls. And then we did various different teams and a barbecue afterwards. And again, it was that real sense of, I just moved there. But you could see it, like these were people who knew each other well, who connected all the time and who just enjoyed each other's company and had fun together. There was a real sense of that work family of, you know, this is a huge part of our lives. We're doing that meaningful work. We're in a good environment, and this is prioritized, us spending time together during the workday. So I thought that was wonderful. And if I may just lead on from that a little, where I think then that comes back to moving away from the kind of concept of this just being something that's outside of work, I think it becomes very meaningful then in terms of patient safety and best outcomes, because I then saw that team in action a while later, in that we were doing a difficult case, an unusual case. And so the surgeons and myself, we were thinking it through and planning it the day before. And I remember coming in that morning, and the nurses who were assigned the case had really read up about it, which I thought was really proactive and really, it was really struck me. And they'd kind of thought around it, and they said, oh, we wondered if you might want some pericardium for this case, because you might want to sew this, or, you know, and they thought of a few other instruments and things that we might need. And I found that fantastic, because again, that spoke to me of such a positive culture, that they knew this was a big case, but it was meaningful to them to really read up on it as well, and to understand what was happening and how could they contribute, what more could they bring to that case, which was going to be tricky. And to me, that really struck to how that brought all of that together, that sort of well-being at work, that connection, that team culture, but that actually brought the best outcome for that patient, because not only was one person thinking of that difficult case, but everybody on the team was thinking about it. And everybody was bringing their best expertise to that patient.
Yeah, that's fantastic, Niamh. And so much in what you've just shared with us about the Australia experience. And I think it really, you have just given us, you know, a great case study on those 3 points: the listening, the communication, and the connection piece. And I'm also struck by the fact that this is not just a nice to have. I mean, we all want to work in organizations where we're listened to, communicated well, we have a connection. But there's really compelling evidence now, and even the US Surgeon General, who has who speaks, recognizes workplace health and well-being as a public health issue. Talks about how it's not just the right thing to do, but there's a strategic advantage for organizations. And particularly in healthcare, the biggest pain point globally is a talent shortage. It's recruiting and retaining healthcare talent. And indeed, Laura, organizationally as well, there is a global talent shortage. So this is one key area of focus, and particularly for the younger generations, and even going back to my own doctoral research, I always remember I looked at engineers, lawyers, and accountants in my study, and there was very little difference between the professions. But one phrase that kept coming up over and over again was, I don't want to be treated as just another number. And we talk in organizational psychology about individualized consideration. So that was a great example of it, Niamh, getting that message around the museum. You know, I understand and appreciate what's important to you, where you go to refuel, and that thoughtfulness in doing that. So, you know, I really think it's important to look at the impact of all of these measures as well. Okay, I'm conscious. Laura, you're going to come in there.
Yeah, there was something else there, and I loved all of Niamh's case studies and examples. The other thing that I loved about the final one that you shared, so leadership isn't just the most senior leader's role. We often talk about leaders at every level. And when we think particularly about trying to lead for healthy organizations, trying to lead for well-being across organizations and industries, it does need sort of the total approach, and to have leaders emerge at every level around it. And I loved in your example, Niamh, how that whole team took a sort of a leadership style, even though they may not have been the most senior person involved. So that empowerment and that leader at every level piece, I thought that was a really nice example of that as well.
Yeah, fantastic.
Sure, yeah.
Thank you, Laura. So I could talk to you both all day long. It's been so fascinating, but I'm conscious of the time, and I want to just wrap our webinar with a question, a final question to you both. In the Centre for Positive Health Sciences, we like to be pragmatic. We like to give, you know, solution-focused approaches to health and well-being. And my question to each of you, if there was one piece of advice you'd give someone listening to this webinar, perhaps somebody who's managing a small team, somebody who's managing in a global organization, or somebody who's about to step into a leadership role within an organization, what one piece of advice would you give that person to really focus on creating a positive workplace culture? And I might go to Laura first on this, please.
So it's hard to pick just one thing.
Thinking the same thing.
Yeah, but with that context, and a little bit on my own experience in stepping into the role and the enthusiasm and trying to, you know, maybe take on a lot to see, you know, a big sea change. Actually, maybe don't get too bogged down in trying to do everything. Pick a few key focus areas for your context, for your organization, for wherever you are. Get some baselines around that, talk to people, building on what Niamh had said earlier, listen to see what are the key things, and get laser focused on those. So prioritize, get comfortable deprioritizing and having sort of rationale for that, and focus, laser focus.
Great, love it, Laura. So don't try and take on too much. Get laser
not good for your well-being.
No, it's not exactly. We don't want the irony of somebody getting burnt out in this space. So laser focused, really prioritize, and get comfortable deprioritizing. Fantastic advice. Niamh, over to you.
Okay, I definitely find it hard to do one piece, but I think what we spoke about earlier is that sort of contagion. So we know that sort of incivility in healthcare, for example, has huge impacts downstream, but also that positive will also have a huge downstream effect. So to me, like, I think it's actually, this might sound very basic, but two things. I think, first of all, thank people. So hugely recognize the work on a daily basis, to sort of, like, even after we finish in theatre, I make a point of thanking everybody individually, chatting to everybody, particularly if we do, you know, we're starting out new down here in Cork, if we do a new operation, to really celebrate that success and everybody's part in that success. So I think thanking people is hugely important. And I think then those little connections that you can make every day. So assuming that, you know, particularly as a leader, that you're attitude, your leadership, what you bring to that's going to spread. So exactly as you were saying earlier, Laura. So I think when I come in the mornings, I would always try and make sure that I'm saying hello to people. I'm remembering people's names, maybe trying to remember something small that we talked about the last time. And where can I connect with people? And that might be as simple as like, one of my pet peeves is sort of stepping into the lift and everybody's on their phone. But like, that's a great moment to chat to people. And it might just be chatting about the weather or something very simple, but you're creating that environment of like, this is a nice place, for patients to come in and then see that people are chatting amongst themselves. They're connecting all the time. To me, that's so important. I think that might sound very, very basic given how much we've discussed on this webinar, but I think to try and connect at every opportunity and to thank people would be the two things that I would start with.
Niamh, absolutely excellent advice. And I'm reminded of almost every employee engagement survey I've ever rolled out over the years. You always, always, always see lack of appreciation up in the top three. So that act of thanking people, showing appreciation, those connections that you make, taking that individualized approach. And I think what's really wonderful about what you've just shared, Niamh, it is no cost, high impact.
That's what I was going to say.
Yes, so it was lovely to actually, and this was not scripted in any way, but Laura, you took more this sort of strategic sort of, developing a strategy around this, and Niamh, you took the more, the individual approach, what's within the gift of the individual. So that has been just such a wonderful conversation, so many insights. I think you've both shared very practical suggestions with us all. And I am deeply grateful to you both for your time today. I think, Laura, you have given us such a great insight through the organizational lens. And can I just recognize that great background you have, everyday moments of well-being?
Yeah, I love that.
And also to build on what Niamh said, so the everyday moments of well-being is actually an acronym, and the T stands for thanks. It's for a moment of thanks, because it's so important to recognize. I think we said it at the top of the session. So I was so glad when you mentioned it there, totally unscripted, and thank you for spotting it at the end, Mary.
Yes. Wonderful. Well, I'll just wrap by again expressing my thanks to you both on behalf of the RCSI Centre for Positive Health Sciences. Thank you both.